Good evening, America. It is 7 p.m. Thursday, May 21st, and this is Q News Tonight, the world's first live LGBTQ daily evening news. It is time to queer up the news. We begin with breaking Q news. Trump throws a tantrum as states move to vote by mail before the November election. We've prepared some video for you. Watch this.
If people mail in ballots, there's a lot of illegality.
President Trump firing off a barrage of false tweets, attacking officials in two key swing states, Michigan and Nevada, for making it easier for people to vote by mail. The tweets wrongly accusing Michigan of sending ballots to all voters and threatening to withhold federal funding to both states because of election changes due to the coronavirus pandemic. Michigan is sending absentee ballot applications to all voters, and the state's law allows any voter to cast a mail ballot for any reason. The tweet prompting this response from Michigan's governor, Gretchen Whitmer.
To see Twitter this morning and to see rhetoric like that is disheartening, because I think it first shows you that there maybe was a lack of understanding of what the Secretary of State was doing.
Legal experts say Trump is also unlikely to be able to unilaterally withhold funding Congress has already appropriated because he
President Donald Trump on Wednesday lashed out at officials in two swing states, Michigan and Nevada, over their moves to make it easier for more voters to cast their ballots in the mail ahead of the November election, highlighting his growing anger over mail-in voting changes that he contends will hurt his chances of re-election.
The president's harsh and often baseless criticism of vote by mail is significantly ratcheting up as more and more states loosen their vote by mail restrictions proactively or on court orders.
The latest, Texas, where a federal judge ruled on Tuesday that all voters can request an absentee ballot if they fear contracting the coronavirus by going to the polls in person, dealing a blow to Republicans in the state who had argued against sending ballots for that very reason.
And in Michigan, the state's Democratic Secretary of State said this week that all eligible voters would be mailed an absentee ballot application ahead of the November general election. Michigan is one of dozens of states that allow voters to cast their ballot by mail for any reason, and it is a key swing state in the November presidential election.
In his tweet Wednesday morning, Trump falsely claimed Michigan would send absentee ballots to 7.7 million voters. But he also threatened to, quote, hold up funding to Michigan if they want to go down this voter fraud path. Trump, several hours later, deleted the tweet and sent a new one that correctly described Michigan's absentee ballot initiative.
Every fact check conducted on Trump's tweet and comments indicate that the president does not have the power, as it is left to Congress.
I don't know if either of you have ever experienced any kind of voter suppression before. I have, where the whole location seemed to be down and they were just pretending to be so that less people would come. It was in a lower income area. And I'm more and more concerned as I get older to see this seemingly happen, especially in minority regions, and that would be affecting us directly in the LGBTQ community.
I know that if trans people had the ability to vote by a mail-in ballot, a lot more of them would be able to vote. Sometimes you walk in presenting masculine, your ID says feminine, or vice versa. Walking in feminine and your ID still has your old name. It's very embarrassing for trans people to go to the polls. And I think this would be much easier for trans people to vote. So that could be a good thing.
The entire context of this story is a lie. Voter fraud has not been proven. He cannot draw on any statistics that show voter fraud. The individual states can manage mail-in votes. Even the Republican-ish, reddish states of Texas is capable of doing it. His entire premise is designed for voter suppression, and it is based on a lie. So good evening, America. It is 7 p.m. Thursday, May 21st, 2020. It is time to queer up the news. We are literally out of the closet and into the headlines. So many of your stories we are going to tell tonight on Q News Tonight. Tonight on the world's first live daily queer evening news show.
Tonight's news about the gay community and the news from an LGBTQ perspective. Are our gay stories important to you? In headlines, politics, entertainment, gay culture, travel, religion, and more. reported by respected anchors.
Out of the closet and into the headlines on Q News Tonight. Thank you for joining Q News Tonight. We are live. This is a live show, so anything can happen. Tonight we bring you the news of and a perspective from the LGBTQ community. Be sure to stay tuned as we bring you an amazingly good news story, even despite coronavirus pandemic. I'm your anchor, Al Ferguson, and this is my co-guest anchor, Misty Eyes.
Hi, I'm super excited and I have to steal it. We have an amazing coronavirus good news story. Napoleon called it and I'm stealing it too, of a little lesbian changing the world.
And my friend, anchor Napoleon Plays. I can't wait for this answer.
That's
What are you
right.
looking for,
No,
too?
you're going to be so excited to hear this story because she's Kid Governor. And no, that's not just a superhero name, though she basically is a superhero. Stay tuned to find out more about this incredible story.
Both anchors fighting over the same
We agree.
story.
That's a good thing.
We're live, America. Let's cue up the news.
We are proud to share with you that our LGBTQ television network supports the unique live broadcast of Sunshine Cathedral's Sunday church service, the world's most popular LGBTQ queer religious broadcast. And we are proud of our diverse 501c3 and charitable support.
The Happening Out television network is the largest live LGBTQ media platform on the planet.
With Q News Tonight, It's Happening Out, happening.fun, our network is the most important live LGBTQ video website in the world, breaking the elite 10,000, according to Alexa Analytics, as the number 9,462 highest traffic website in America. And that is out of 900 million websites.
We are proud to share this honor with the company of the historic news magazine, The Advocate at 11,467, the Lifestyles magazine, Out at 14,337, America's most important LGBTQ civil rights organization, the HRC, at 22,281, and America's most important LGBTQ media and image organization, GLAAD, at 52,196.
We are prime digital TV partners with both YouTube and Facebook. And in April, more than 2.2 million watched our LGBTQ shows. We are the source for the LGBTQ community for news, talk shows, and entertainment.
In the confidence you have in the confidence that you have in Happening Out, we will continue to be your live source of news, talk shows, and entertainment for the LGBT community. So let's queer up the news. First, let's catch up on all of the news surrounding COVID-19 with our quarantine quickies. The first story tonight is in our daily reporting of the coronavirus facts, especially important to the LGBT community. The facts for Thursday, May 21st, 2020. We report on coronavirus case numbers first. Based on the standard acceptance of 7% population reflects the LGBT community, we report that America's LGBTQ COVID-19 cases stand at 111,000. The world's LGBTQ COVID-19 cases stand at 358,000. Total USA cases stand at just short of 1.6 million, while total world cases of COVID-19 are over 5,100,000. We remind you that America is ground zero of the pandemic. The USA is just 4.4% of the world's population, and today America is 31.1% of the world's cases, slightly a percentage lower today. We report on coronavirus deaths. America's LGBTQ COVID-19 deaths stand at 6,658. The world's LGBTQ COVID-19 deaths stand at 23,166. Total USA deaths stand at 95,000, while worldwide deaths are now over 330,000. America is nearly a third of all COVID-19 deaths on this planet. The USA, again, is just 4.4% of the world's population, and now we account for 28.7% of all the world's deaths, a percentage that is slightly higher today. President Trump and Vice President Pence have said a lot of ridiculous things about testing in the LGBTQ community. Here are the testing facts in terms of what they suggest. As of today, we have 14,196,000 tests that have been taken, and contact source tracing is dramatically lower than that number. But this continues to be a dismal number. We give the White House testing a grade of D-, slightly better this week. There are 328 million Americans, which means they earn this grade because only 4.8% of the population has been tested. The medical community recommends our testing rate should be 10% for reopening. Despite what Trump and Pence tell our LGBTQ community, testing and contact source tracing is the #1 solution to pandemic. Q News Tonight recognizes our Hall of Fame top states in testing. #3, North Dakota, #2, Rhode Island, and start spreading the news. I'm leaving today for #1. Congratulations. New York has moved to the highest testing percentage in America at 13.4%. Woohoo! That leads Q News Tonight to recognizing our Hall of Shame states. Doing the worst job in testing LGBTQ America. We hope you don't live in one of these states because #5 in Kansas has only tested 2.5% of its population. #4 Oregon, #3 Colorado, #2 Idaho, and #1, you know who is #1.
Quarantined quickies. At least 4 states have been combining numbers of COVID-19 tests, leading to confusion in results. We've got a video prepared for you. Watch this.
Getting tested is one of the keys to tracking the virus and containing the spread, but we now know at least 57,000, or about 14% of Georgia's tests, are not what they seem to be. Our testing numbers skyrocketed over the past 3 weeks by nearly 200,000 tests. However, today we learned that back in April, the state started including antibody tests in that count. One expert we talked to explained that's like adding apples to the number of oranges. So we asked Georgia's top public health official about the impact of combining both types of tests.
One indicates past infection. It's not, the antibody tests aren't a good indicator of current infection, and CDC doesn't recommend that it's used in that way.
All right, so what's the result? It makes it look like the state is testing more people and fewer people are getting the virus. Guys, that's not true. And as Reveal investigator Brendan Keefe just showed, one person may get tested multiple times in different types of tests. That really matters a lot when you're trying to track the virus. On Monday, the state praised the rate of positive cases was now down near 10%, and we were testing 3.3% of the population. All right, that would meet the CDC's recommended guidelines. Cool. Those percentages are actually significantly lower now. We've asked DPH if antibody tests were included in the count before, and we're told no several times. But with this discovery, Georgia's current testing numbers are misleading. Our numbers team will keep pushing to get you answers and clarity from public health officials and the governor.
At least 4 states combined data from 2 different test results, potentially providing a misleading picture of when and where coronavirus spread as the nation eases restrictions. Coronavirus testing is a mess in the U.S. Report says Virginia, Texas, Georgia, and Vermont have said they've been adding 2 numbers to their totals: viral test results and antibody test results.
Combining the 2 tests results in a one total that could provide an inaccurate picture of where and when the virus could spread. The combination could also overstate a state's ability to test and track active infections, a key consideration as states ease coronavirus restrictions.
Experts have consistently emphasized that for states to reopen safely, adequate testing and tracing is needed. Elizabeth Cohen, CNN's senior medical correspondent, said, quote, "You only know how many cases you have if you do a lot of testing. If you put the 2 tests together, you fool yourself into thinking you've done more testing than you have."
Texas, Virginia, and Vermont have said they've recognized the data issue and moved to fix it in the past few days. In Georgia, health officials said they've been adding antibody tests to their total test number in line with methodology from the Centers for Disease Control and Prevention.
The thing is, a lot of people think I was sick a couple weeks ago, and then they go and get their antibody test. Technically, they were positive for COVID-19, but now they're adding those totals to 2 different categories, and that's actually not quite accurate.
More than not accurate, it could be actually misleading that causes harm in the reopening plans. Because if the CDC's plan, even though it's been watered down by the White House, is followed, it's an indication that maybe they should not do that yet because the testing total numbers are not where they should be.
And that doesn't even say anything for the LGBTQ community, who frequently do live in lower income locations, which means that they're not being tested at the same level as everybody else. So while we report the numbers at the beginning of the show, those are optimistic at best.
Quarantine quickies. 1 in every 4 Americans have a hesitancy about taking a potential COVID-19 vaccine. A Reuters IPSOS poll published Thursday found a quarter of Americans have little or no interest in taking a coronavirus vaccine, and voicing concern that the record pace at which vaccine candidates are being developed could compromise their safety.
Some 36% of respondents said that they would be less willing to take a vaccine if the U.S. President Donald Trump said it was safe. Among those respondents who expressed little or no interest in a coronavirus vaccine, nearly half said that they were worried about the speed from which the vaccine was trying to be developed.
More than 40% said they believe the vaccine is riskier than the disease itself. In addition, misinformation about vaccines has grown more prevalent on social media during the pandemic, according to academic researchers.
Peter Holtz, then from the National School of Tropical Medicine at Baylor College of Medicine, said in a world where President Trump provides so much information, it is not a significant percentage of Americans, it is a significant percentage of Americans that are not going to take the vaccine because of the terrible messaging from the White House.
So just to clarify, what you're saying is that the president is giving out so much wrong information that nobody knows what to do. He's saying this, he's saying that, as we see in the video. He's saying he's testing positively, negatively, or whatever other, Broadway song he wants to create out of this. And this definitely creates misinformation and mistrust in our leaders. So especially if you're part of the LGBTQ community, who's already been targeted from him many times in the last few years, I would be even more skeptical with how he's speaking now.
Many of our LGBT communities struggle with addiction, smoking, alcoholism, drugs, and not to mention HIV/AIDS. And being hesitant with your immune systems, etc., I don't blame them for being reluctant to be interested in the vaccine.
I don't understand why the president doesn't respond to a number like this. 40% are saying, I don't believe him, to the point that I won't take the vaccine because I'm scared it's coming out of his mouth. Quarantine quickies. 2.5 million LGBTQ members of our community lose their jobs because of coronavirus pandemic. The LGBTQ unemployed in America now crosses 2.5 million. Today, the Department of Labor reported that an additional 2.4 million unemployment claims were filed this week, bringing the total now to 36 million that have lost their jobs because of the coronavirus pandemic. Because of the standard acceptance of 7% of population, this means that approximately 2,520,000 LGBTQ Americans have lost their jobs and filed for unemployment since the COVID-19 pandemic began.
It's a tragedy when anyone loses their job, especially when it's done in this mass. But as will be reported, I'm sure, from Misty in the trans community, all of the LGBTQ community is very, very at risk of ending up in sex work. It's something that has been tied to the LGBTQ community for a long time. And that being illegal means that they are then potentially going to end up in jail or somewhere that they could get more, be near more infectious people. It's this endless loop and endless cycle, and it's heartbreaking.
The reason many trans people specifically turn to sex work is because nobody will hire them.
Yeah.
America, look around and think about the people at your jobs. How many of you have a coworker that's transgender? Now, with this pandemic, even more. The ones that do have jobs were probably the first to be let go.
I am glad that this is the last of our quarantine quickies for the week, because the news this week for LGBT has been grim. We report that 2.5 million LGBTQ are unemployed. We reported this week that the #1 sector is in leisure and hospitality, and LGBT, that is our #1 employment segment. The news this week has been really tough in terms of employment and COVID-19.
Well, fortunately, Al, we have our next segment where we queue up our segment called Coronavirus Good News, because after we finish our quarantine quickies, we like to lighten it up when we all need it. We've reported all of the statistics and facts for the day, but now we want to report the things that made us smile today in Coronavirus Good News. Coronavirus Good News. You've been waiting for it. The kid governor of Connecticut is an amazing 11-year-old lesbian. 11-year-old Ella Briggs was elected the first out kid governor of Connecticut in 2019, and she ran on a pro-LGBTQ platform in the election for 5th graders. Now Briggs has her eyes set on higher offices. She says she will be the country's first lesbian president. Briggs said during her swearing ceremony, "I will begin important conversations with students and adults all over this great state. We will talk about what it means to be accepting and respectful of everyone, including those of us in the LGBTQ community."
6,400 students from 87 schools participated this year, but some of her classmates at Anna Grace Academy of the Arts Elementary Magnet School refused to attend her swearing in. Some parents would not allow their children to go. Briggs said, "I'm just so happy that most kids in my class came. There were some kids who pulled out, but you can't do anything about that. Haters are going to hate. It's just so amazing being in a room full of people who accept me. It feels really good."
Ella Briggs represents everything that we all want to be when we grow up. And that makes her Q News Tonight Coronavirus Good News. Watch this.
Okay, so I like girls. I must be a boy. I didn't think to myself, or maybe I'm just gay or lesbian or whatever. Everyone called me he, so I'm just might just be easier. And then I'm actually, I like being a female. So, more fun. I'm Ella Briggs, I'm 10 years old, and I am the 2019 Kid Governor.
That's Brian. They're posing for pictures, so just pretend I didn't open this one.
As the new Kid Governor, I will begin important conversations with students and adults all over this great state. We will talk about what it means to be accepting and respectful of everyone, including those of us in the LGBTQ community. A lot of kids don't really feel comfortable with who they are. I just want everyone to be happy and be themselves, and I just want to share that with the kids who need it the most.
How amazing that a 5th grader is already thinking about being the first lesbian president. Amazing. We would like to thank our set designer tonight, Concepto Modern Living here in Fort Lauderdale, for making this set in this living museum possible.
Tonight, we are broadcasting from our studio set in the middle of the World AIDS Museum and Education Center. The museum is in Wilton Manors in Fort Lauderdale, Florida.
We joke we're coming from the gayest place on planet Earth.
And if you could look at my view, you would know that's true.
Colorful.
Tonight is part 10 of Q's Q&A on coronavirus and the LGBTQ community, May 21st. This special segment is designed to be unique in America to answer your questions about coronavirus for the LGBTQ community during this pandemic.
Tonight we have an American pioneer in AIDS and HIV medical treatment. With us again is Dr. Howard Grossman, a specialist in internal medicine with an emphasis on HIV. He was the executive director of the American Academy of HIV Medicine. He had a private practice in Manhattan, which was one of the largest HIV practices in New York. He has become nationally recognized as an educator on HIV issues and as an advocate for LGBTQ civil rights and the rights of our community. Welcome, Dr. Grossman. and he has become our medical expert during the pandemic for Q News Tonight. Before we get into viewer questions, it's been another big week in COVID-19 and the White House and the President and the Vice President from a science and medical community. Before we take the viewer questions from science and medicine, I just want to ask, what's on your mind this week? And welcome, Dr. Grossman.
Thanks. It's great to be here again, and I'm in my full medical drag tonight,
Drag.
as you requested.
Right.
I've even got my pronoun button on, which everybody should wear.
That should be every part of every doctor's uniform.
Exactly.
They do that I mean, Midway is great for that.
This week, I think, we had a lot of scary news about rising rates in at least 14 states and in certain metropolitan areas like Los Angeles, and I believe Dallas and a couple of other cities, Chicago, that are frightening as we reopen the country. I think we had some good news this week as we learn more that that testing positive for antibodies does seem to have some protective effect for people. We don't know for how long, and we don't know whether there are certain levels that need to be reached, but it's pretty clear at this point that I don't think you can point to a single documented case of reinfection anywhere in the world. Almost all the cases, or at least all the cases I've seen that were considered to be reinfections, so getting infected a second time, were actually due to the test picking up viral debris that is not infectious.
Well, that takes us right into our first viewer question, wherein a poll is out that states that 25% of Americans are hesitant about COVID-19's vaccine. What would this mean for herd immunity?
Well, I think first you have to look at this, Napoleon. There's really two different things going on here. One is the anti-vaxxer movement, which is these crazy people who think vaccines cause, I don't know, pointy heads or something, who won't vaccinate their own children and try to prevent other people from vaccinating their kids, are going wild with all of this. So there is that movement. On the other hand, I think a lot of this resistance has to do with the fact that it's coming from Trump. Trump is clearly trying to push out vaccine before its time. Vaccines take time. We're talking about a preventive vaccine. So a vaccine where you're going to document that it has neutralizing antibodies that can stop the virus, and you're going to document that they last for a while. Those trials take a while. They don't happen in 2 or 3 months. We want a vaccine that's going to prevent this for years until there's a cure, at least.
And as it relates to vaccine, do you give any hope at all? He has suggested by the fall. Do you give any hope at all? And I know you're looking into the Dr. Grossman crystal ball, but any hope at all that we'll have a vaccine before the end of the year?
No, I don't think we will. Like I said, it takes time. You have to prove this thing works over an extended period of time and in a large population of people. Unfortunately, our terror porn news that's out there on cable that has to fill up 24/7 news puts out things like yesterday when the first study from one company, Moderna, of 8 patients that got a vaccine that they developed have neutralizing antibodies and didn't die. Okay, so that's 8 patients. First of all, it's nice safety study.
Good start.
It's a good start, and we should be cognizant of that. But the next step is to test this in hundreds of patients and see if the same thing holds true and if it's also still safe. And then it's going to be to test it in thousands of patients and see. Unfortunately, what we deal with a lot of this stuff is science by press release. And this is something people need to be very suspicious of. There's a really great editorial yesterday by William Hasseltine, who was a big AIDS physician since the beginning of the epidemic, that talks about science by press release and the dangers of that. You get these things where they're releasing minimal data. You don't really see the data. They're just saying it worked. And then suddenly their stock triples or doubles or goes up by 50%. And we never really get to see the data. you know, you don't get to see the data.
And now they're saying that they're even skipping animal trials for it as a preventative measure. But I think the next question is also about preventative measures.
Sure. A viewer asks, Hong Kong has a new study showing masks dramatically reduce COVID-19 infections. Why are so many people not wearing a mask?
Well, first, I think we need to remember that masks make a difference. When we first started with all this, we didn't know that masks make a difference. But in fact, they do. And, you know, so you have these 6-foot distancing rules. You know, I've been saying for weeks that I want to know if you stop people who are coughing and sneezing from, say, going into the supermarket, and everybody who goes into the supermarket is wearing a mask, does standing 6 feet apart make all that much difference as far as risk? And we don't really know that. All the 6-foot distancing stuff that's now become this giant meme with stuff on the street everywhere is all based on not wearing a mask. And so I think, you know, that's something we need to think about. Truthfully, the people who won't wear masks, I ask, is it, you know, why can't, you know, like there's a woman that got filmed saying she has a medical condition, she can't wear a mask, and I wonder what the medical condition is. Is it that you have so much shit coming out of your mouth that you're going to choke on it if you wear a mask?
That's hilarious.
I mean, basically, wearing a mask is a matter of respect.
You know, it's funny.
I have antibodies, okay? If they're protective, I don't really need to wear a mask. It's a guess, but I don't really need to wear one, say. But I wear one when I'm out in public because it's respect for other people. It's not a lot to ask.
I believe I read from this Hong Kong study that it indicated you had a 78% effectiveness compared to not wearing the mask in terms of spreading the virus. So,
and let's face it, in China, for years, every time it's in Japan, and in many of the, you know, of countries outside of here, wearing a mask when you're sick has been a standard procedure.
Well, my favorite has been seeing people that are in the fetish community say that they can't breathe in the mask and then juxtapose that to them being choked in the bedroom about how they can't breathe. It's a good dichotomy, yeah. So our next question comes from a viewer at home. What does it mean to be immunocompromised? And would someone know if they were 100% of the time? Would they know 100% of the time that they were immunocompromised?
Well, immunocompromised means that your immune system is not able to fight off normally things that you would normally be resistant to. And you know, sometimes you can know. I mean, we know that people with HIV with very low T cells were immunocompromised, which is why they got opportunistic infections. Fortunately, people with HIV don't seem to be at any increased risk from the coronavirus, which is kind of amazing, but that's what seems to be happening.
Medicated HIV or all HIV?
You know, they're saying all HIV at every T cell count. Since most people with HIV are on medication, it's very hard to draw that distinction. But, you know, clearly we had at least one small study out of Hong Kong that used drugs that we've used in HIV and in MS, in multiple sclerosis, that seemed to show some efficacy. So, you know, I do think that medications may be making some kind of difference.
Another viewer asked, do you think that numbers are being manipulated for political reasons, or do you trust that the truth is getting through?
Well, you just had a big story here about how, you know, these states that are combining antibody testing with acute infection testing. Now, what does that do? What that does, you really didn't talk about it, but what it does is make it look like they're doing a better job than they're doing. Right. So let's say you had 50 antibody tests and 50 acute tests, the PCR, the nasal swab. And let's say 5 of those people were actually infected. Then you have about a 5% infection rate. If, on the other hand, you're just looking at the number of people who are actually acutely infected, it's more like 10%. So it makes you look like you're doing a much better job than you are, and it makes it look like there's less infection than there is. So that becomes less of a problem, which is exactly what a lot of these politicians would like to get people to believe. And this is the biggest thing. You know, you look at this thing, and Trump and Pence are, number one, convincing people they don't have to wear masks. Okay? Now, here are people who are tested every day, multiple times a day. Everybody around them is tested every day. You know, so yes, they feel safe, but this is not the situation for the rest of us.
Yeah.
But they're convincing people that the mask thing and following the rules is for losers, to use Trump's words.
Speaking of,
and they're also trying to convince people this is a temporary situation, which I think is really scary. Because this is not temporary, and we need to make some big changes in the way we do things for the next few years. But they would like everybody to believe it's temporary.
While we're speaking of antibodies, the next viewer asks online, antibody testing is under full attack. I know Al experienced this. Why is this the case, Dr. Grossman?
I don't really understand why people are rejecting doing antibody testing. The state of Florida is not recommending antibody testing. Now, are there questions on the antibody tests? Yes. Are many of the rapid tests not reliable? Yes. Do we not know how long the antibodies last? Yes, we don't know that. We don't know what level of antibody production is helpful. But we do know there's evidence that these antibodies seem to be protective. We do know that a person who tests positive for antibodies is a person who encountered the virus and developed a reaction to it. From an epidemiologic point of view, I would think you'd want to know what the prevalence of the virus is in your community. And that, if nothing else, the test answers that. And it's a simple blood test that can be sent to a commercial lab right now, and those are probably the most reliable tests out there.
Let's zero in on that soundbite that you just delivered. Quest and LabCorp, which are the two largest,
and BioReference,
are super reliable. Would you agree with that observation?
They're the most reliable we have.
Yeah.
They claim, Quest, for example, claims that their test is 100% sensitive and 99.4% specific. So that means if you find the virus, it's really coronavirus.
All right. So the science is of accuracy. The other thing that is super important in this question that Napoleon and the viewer asked is after you're identified that you've antibodies, like in your situation, my situation now, Chef Josie's situation, why do you think, especially in social media, so many people are saying it doesn't matter, it doesn't matter, it doesn't matter? What is behind the rejection of historical standards of having antibodies and why it can't be applied here?
Well, not every antibody is protective. Let's face it, you get antibodies to HIV, they're not protective. You get antibodies to herpes, they're not protective. So there are viruses where antibodies are not protective. But we don't know yet with this, but it does seem to me that the information is trending in that direction. Number one, I think there's a lot of, I call them negative Nellies out there. First of all, on TV, as I said, a friend of mine calls it terror porn, whether you're looking at CNN, MSNBC, Fox, it's keeping your eyeballs glued to the TV 24/7. And so talking heads need to sound smart. They sound smart when they're naysayers. And I think that's a lot of what's happening here. I'm not sure why people think if they're negative, they sound more intelligent if they just keep repeating the same garbage that's coming out all the time.
Like the President of the United States.
Positively negative.
And one other relation here to this that I want to ask specifically, as it relates to your challenge, I don't see a case of reinfection for someone that has antibodies. How do you overcome that argument? That, okay, maybe it is anecdotal, maybe it isn't proven in terms of scientific study, but the challenge is show me somebody that has been reinfected by COVID.
Right. And to show that, you would have to culture virus from that person and show it's infectious. Not just so that you have some remnant of viral debris, but actually show infectious virus.
Yeah.
And that has not been done. So every time you see one of these people who says, oh, I got reinfected, where's the culture? Right. show me the money.
Yeah.
I mean, I think that's one thing. The other thing is, let's say you get an antibody test and it tests positive, but you really aren't immune. What's the worst that's going to happen? The worst that's going to happen is you're going to go out and you're going to infect a few of the people around you. Is that any different than all of these people running around without masks at all of these Confederate, Nazi, Trump rallies? Is it really going to bend the curve upwards again if a few people who test positive decide that they're going to be more reckless? I don't think so.
We have another viewer question. In some studies, vitamin D deficiency has been linked to worse outcomes for people who get COVID. Is it beneficial, neutral, or harmful to supplement with vitamin D?
Well, this is still being looked at, but it is clearly evidence whether it's causal or not. There's evidence that people with vitamin D deficiencies have done worse. Now, does that have to do with the fact that many of these people are elderly, and elderly people are more likely to have vitamin D deficiency? Is it a cause and effect? Nobody can really tell. But vitamin D has been shown to have impact on immune reaction, and we know that so much of the mortality, the death from coronavirus, has to do with an overactive immune system. So, possibly there's some immunomodulatory effect there. I don't think it hurts. We tend to overdo vitamin D. I think it's easy to check levels, and it's easy to supplement with small amounts of vitamin D. But we don't want everybody running off and spending tons of money on getting vitamin D levels.
Yeah. So moving on from the biology lesson to a little bit of a history lesson, how have pandemics ended in the past, and what makes COVID-19 different from those?
Or does it?
Well, I mean, pandemics in the past have ended by killing off most of the susceptible people. So you look at the Black Plague in Europe in the Middle Ages. Look at when syphilis was introduced in the late 1400s into Europe from Asia. Millions of people died from syphilis. That doesn't happen anymore. That's because it selected out the people who were most vulnerable. But these days, I think, and the Spanish flu, what they call inaccurately Spanish flu in 1919, it died out partly because of weather and what that does to influenza virus, and also partly because of precautions that got taken maybe too late. Now we're in a different place. Now we can develop vaccines, we can develop treatments. So truthfully, I think this pandemic ends when we have adequate treatment and we have a vaccine.
Speaking of precautions, another viewer asked, some countries are spraying disinfectant on public places or spraying disinfectant on people. Why aren't we doing that in the United States?
Spraying disinfectant on people, I love. Why aren't we?
Well, that's better than injecting.
I'm sort of I'm sort of surprised that we aren't, given the way the Trump administration is, because I think that spraying bleach on streets and things like that is just making it look like you're doing something. So how is this virus transmitted? This virus is transmitted as a respiratory virus, sneezing, coughing, touching something that somebody just touched, and then touching your face. Unless you're going to be licking the sidewalk, I'm not sure what the I'm not sure what what the bleach is going to do. Plus, sunlight is going to inactivate bleach. Dirt is going to inactivate bleach. Like I said, I think they're just trying to show that they're doing something.
I'm curious as it relates to this. So you're saying no on the spraying.
Yes.
CDC has breaking news this afternoon that COVID-19 is not as infectious on surfaces, boxes, utensils in restaurants. What do you? I know it's brand new. The CDC has just announced this afternoon. What's your first reaction to what CDC is saying?
It's what my reaction was from the beginning of this. That's what you call a disease on fomites. So fomites is the box, the things that it's sitting on. Yes, there is. It can last for some time on those, but HIV lasts. And how many people got HIV from a table? Zero.
Yeah, and that's what the CDC point to this announcement is. Even in presence, it's generally not infecting you.
Right. You cough on your hand, you push an elevator button, somebody comes right behind you, pushes the same button, touches their face. That might do it. But so what do you do? Don't touch your face in the elevator.
Exactly.
Put a hand sanitizer thing outside.
If we
get
were
off
religious
the
on
elevator,
our hand wash,
right.
Surface contact would be.
So remember, infection control for 15 years in hospitals has been foam in, foam out. You've all seen it. Doctors go into a room, they use the sterilizing foam, and they do their hands. When they walk out of the room, they do their hands. At Beth Israel Deaconess, where I worked for a little bit in Boston, they had people watching you to make sure that you did that. So this is something that took a while for doctors to do, and nurses. Took a long while, but that is standard procedure now, and that needs to be standard procedure. You walk into the supermarket, you foam in, you put your mask up, you do your shopping, you foam out, and then you go home. And like when I was a kid, my mom used to say, when you come in from the street, wash your hands. Okay, we need to get back.
America, LGBT community, Q community, I cannot emphasize enough the observation and the advice you just heard. It is probably the #1 thing that we can do to make ourselves safe individually as we begin to reopen. The governor of your state could be crazy, the president could be crazy, but this is advice to help protect yourself. You make your own decisions.
So that means everyone with a dungeon, have that sanitizer right outside so you can go in and come out knowing that you're clean. Our final question, do you see any new signs of hope, we were just discussing some, that the government's response is improving going forward?
I see the opposite. I think they're driving people to have more infections. But, you know, I don't know if you call it good news, but I heard that one of the gay bathhouses in Dallas is reopening with with distancing, and showers aren't going to be open and stuff like that.
How do you social distance at a sex club?
And you know, unfortunately, we're also seeing the collapse of a bunch of gay bars. So there's a gay bar in Dallas that's closing. The Stud in San Francisco is closing after 55 years. We're seeing a lot of destruction. Roosters in West Palm Beach had a fire and couldn't afford its insurance because they were busy paying their employees during this crisis. So, you know, there's a lot of destruction going on in our community.
And in relation to that question about the go forward, we ask on behalf of Q News tonight, every week, this is our 10th week, part 10 installment. We ask you to give a grade to the President and to the White House Coronavirus Commission and the mission of America's management of coronavirus. You had an F-, you moved to G. By the way, we went to Wikipedia and we couldn't find a grading system that included G. By the way.
God,
this
girl,
week,
get a grip.
What is...
you know, we keep doing it. I just think it gets worse and worse because I think that they are driving people to get infected. You know, the whole point of this shutdown was it gave us time to learn what works to keep us safe. And they are pushing us out without giving the simple message that there's easy ways to stay safe, that you don't have to freak out. And so people, when they give people too complicated a message, they throw their hands up and they say, there's nothing we can do. I give you very quickly, I know we're short on time, an HIV example. In most of the world, they had two simple messages. Don't fuck without a condom, and use a clean needle if you're shooting drugs, okay? Two simple messages. In Australia, in Great Britain, in most of Europe, and their HIV rates were far lower than ours because in the US, people wanted to know, well, what's my risk from oral sex, and what if somebody spits in my eye, and what happens if they bleed 2 blocks away from me? And it was such a complicated message that people threw their hands up and said, I'm gonna get infected anyway. What can I do? And you know, I think it's the same with this. We need simple things. That's why I said those things. Simple things that people can do that's sustainable for the next 2 years, that are new social norms, but that don't destroy our whole society.
Well, we've got a simple government. Simple things should be easy from that.
Let me put you on the spot. In one sentence, the grade this week would be?
H.
An H. Wow. You moved to H. All right, we're gonna research that in depth in Wikipedia. Next week we'll have an answer for you of what it is. Well, that's part 10 of Q's Q&A of coronavirus and the LGBT community. Every Thursday night we bring you viewer questions and the most important medical advice from our medical expert, Dr. Howard Grossman. He runs a medical clinic that is incredibly supportive and in charitable need for the LGBT community here in Wilton Manors, Fort Lauderdale, Florida. And as always, thank you, Dr. Grossman, for being with us here tonight.
Thank you.
Yay.
All right, we're going to move into what we call Q Headlines. And these are the big LGBT news stories of the day, Q Headlines. We'll cue them up now. A truck in Colorado with "Open Our Gyms, Faggot" sign drives around in protest of stay-at-home order in Colorado. A pickup truck belonging to an anti-COVID-19 lockdown protester who was identified by an anti-fascist group as Michael Drewer of Loveland, Colorado, aimed at the Colorado governor, Jared Polis, who is openly gay. The sign said, "Open Our Gyms, Faggot." A member of the anti-fascist group wrote, "There's not much to say about Michael. He's boring and he's bigoted as a man and is living a sad life, whose only joy seems to be coming from skipping leg day, calling gay people slurs, and spreading the virus."
That is a gay slam, telling someone that they skipped leg day. You've got chicken legs, man, chicken legs. Now, I mean, I'm antsy for the gyms to open. I know that it's not just for my body, but it helps me stay mentally on track. So I can relate to that. But there's no reason to be violent. Go out, do push-ups, do pull-ups, you know, chase down some hot person. You can do whatever you want. You can still stay fit, even if gyms are closed.
My first thought is Colorado is not the only state that closed their gyms. My second thought is, how is he getting away with hate speech written on his car? Is he not getting arrested or tickets?
Trump.
I would rather know the enemy by reading it on their
Q headlines. Skittles concedes the rainbow for Pride Month. Skittles, known for its slogan, "Taste the Rainbow," is going colorless this Pride Month. Colorless Skittles Pride Packs are part of the new Skittles Only One Rainbow Matters promotion, going on during June, Pride Month. Skittles is removing the color, but not the flavor, of its original candies and will be donating proceeds from these colorless packs to GLAAD.
I love it when major organizations donate to us, of course, but I also love it when they bring awareness to us. And removing your colors from your candy obviously brings awareness to our community. Thank you.
This is risky. They have done it before. They did it for the Stonewall 50th celebration, but it's risky to have Skittles for an entire month be completely white with no color. Means that if you like Skittles and you're homophobic, you make the decision not to buy their product, and they said, "We don't care."
It is, but that riskiness is exactly why it's so important. So if you're an LGBTQ fan and you're deciding between maybe Sour Patch Kids or Skittles, go for the Skittles. It'll be good training for your jaw because it gets it sore, and it's also delicious, so go for it. They support us.
Good training for your jaw. What does that mean?
It'd be good training for your taste buds because you don't know what flavor you're tasting.
Yeah.
Taste the
But
rainbow.
I'm still thinking about good training for the jaw.
You could use it.
All right.
Q headlines. Politicians in Iraq call for removal of diplomats after their embassies fly the pride flag. Iraqi political leaders have called for the expulsion of foreign diplomats from countries whose embassies flew the rainbow LGBTQ pride flag on Sunday to mark International Day Against Transphobia or Biphobia. Although homosexuality is not criminalized in Iraq, the subject is considered highly taboo, prompting the Iraqi Foreign Ministry to issue a statement saying homosexuality is in opposition to the noble morals of all divine religions.
Well, my first thought is you wouldn't have been saying the same thing when Iraq was collapsing and the Western world, including America, spent $1 trillion in your country. In terms of flying rainbow or related flags, Iraq, shut the fuck up.
That part.
Yeah, this just reminds me of the story we did a couple weeks ago in Morocco, where a trans person who was living in Hungary decided to hunt on every LGBTQ or gay person by having them exposed on Grindr. I just don't understand why this many people have to get involved in each other's business and can't just live their own happy lives in the first place.
We continue in Q headlines by reporting that a Pennsylvania House refuses protections for gender identity and sexual orientation by just 2 votes. Senator Representative Malcolm Kenyatta, a Democrat from Philadelphia, the first openly gay person of color to serve in the General Assembly in Pennsylvania, proposed the amendment, which would have made it illegal for a sportsman or sportsmen's clubs to discriminate against employees on the basis of sexual orientation and gender identity. Cases that deal with these issues are currently before the U.S. Supreme Court. In a pair of cases argued last fall, a decision is expected by the end of the month.
I just want to congratulate him as the first openly gay person of color to serve in the General Assembly. He is a role model for many people, I'm very sure, and I can't wait for more people like that to take any kind of leadership.
I'm going to echo what you just said. That's amazing. It's very rare you see LGBTQ leaders of the people of color community that are out and proud, and I applaud you.
Next month will be the 51st anniversary of Stonewall. With COVID-19, unlike our 50th celebration, we're going to be celebrating it rather quietly. Stonewall proved that you take an action, and even if you're not successful, you continue to take an action.
Truth.
And that's what this representative in Pennsylvania did.
Q headlines. Albania becomes the third country in Europe to ban conversion therapy. Albania took a major leap towards LGBTQ equality when the southeastern European country banned conversion therapy on minors. The Order of Psychologists of Albania announced a new policy banning members from practicing conversion therapy, defined as any attempt to change a patient's sexual orientation or gender identity. The harmful, sometimes deadly practice has been widely discredited and condemned by the vast majority of the Western medical world.
This story is absolutely beautiful to me, and I wish other countries would follow their amazing lead.
This is not 2008 when Obama came to power and had to be educated on marriage. This is not 2000 when Bush v. Gore used it as the wedge issue to win the election. This is 2020. Conversion therapy is dead, and it should stay dead.
I'm happy to see more states taking this lead and more across the world as well.
We end tonight's broadcast with The Big Finish. These are short story mentions of the LGBT news or news with a gay perspective. So here we go. First on Q News tonight, The Big Finish. Good news, everybody. The latest models indicate Trump is going to lose in a landslide due to the economy.
I remember this story. Duck season, rabbit season, duck season, rabbit season. Either way, it seems that we need to have a gunshot to get to the victor, and I just don't buy that this is going to be the result.
I'm on the same page. I'm not getting my hopes up. I never thought in a million years he would have won the first time.
And according to models in 2016, to Misty's point, Hillary was going to win easily, or Donald Trump was a rapist, depending on the type of model you ask. The Big Finish. Mindy Kaling is set to write Legally Blonde 3, and the gays approve of this.
Oh, we do. And this is just in time. I'm sure Al's sexual partners were getting tired of the only move he knew, the bend and snap. So this is for you, my friend.
Yes, please. I will sign up to watch this. And speaking of bend and snap, I hope you bring back the legendary Jennifer Coolidge.
Not to be a snob, but the musical of Legally Blonde is so much better than the movie. And the song, Gay or European, it still makes me laugh. The Big Finish. Trans Maryland is covering the cost so that trans people in the state may change their legal name.
You know, I'm not sure I always have pride to be an American, but especially this past week, I have found a lot of pride in being a Marylander and being from there. Way to go, Montgomery County, everyone across the board. A name is a huge part of self-acceptance, and it's why I've changed mine so many times. You help many people find their identity. Thank you so much, Maryland and Hogan.
I think this story is awesome. Did you know that in the state of Florida, I help many of my clients change their names. And in the state of Florida, if you make under $30,000 a year, it's also free for you. The only thing you have to pay for is your fingerprints.
There's no quip to be had here coming from me. This is just fundamentally decent and beautiful of what Maryland is doing. It's a magnificent undertaking, and I hope more people will join in and more states will do the exact same thing. The Big Finish. No Context Thursday. Here we go. Women realize that the man of her dreams is a racist, homophobic bigot, but isn't sure whether to end it.
Don't worry, Melania. We'll get you through this. We can find you another husband, and maybe one that knows what it means to tan correctly or can see his penis. You know, one or the other.
Speaking of Melania, she's the world's most famous gold digger, honey. But my message to this woman is get out now. What if you have children? You know, the Bible has hundreds of Bible verses about being unequally yoked. For example, if a shorter, slower ox is yoked to a taller, faster ox, All they do is go around in circles. Instead of working together, they are odds against each other. You cannot raise a family with this man. Get out. I don't care how hot he is.
Sometimes I forget that you're from Alaska.
Yeah.
And then I remember.
You know, gay men idolize straight women. We all have our we call the fag hag. We all love them. But you know one thing that gay men have never understood about straight women? Why you're allowing straight men to treat you so poorly.
That is true.
We've never understood it. In The Big Finish, Chris Cuomo teases his brother with a giant test swab live on the air. Now, we're going to show this to you. Remember, Chris Cuomo is an anchor at CNN. Mario Cuomo is the governor of New York, and they battle with each other, and Chris Cuomo is much better. We've got this in video. Watch this in The Big Finish.
Comment that I have a little button nose, and she was afraid that the swab would actually hurt because it extended my nasal cavity.
The proboscis
she was
issue.
Speaking about the delicacy
of the nose. And that's what, you know what, I understand. This is the normal swab I'm holding up here now for everybody at home. A very valuable object. There's only one company in the entire country that makes these up in Maine. All right, here's the swab. Is it true that this was the swab that the nurse was actually using on you, and that at first it went into your nose and disappeared, so that in scale, this was the actual swab that was being used to fit up that double-barrel shotgun that you have mounted on the front of your pretty face?
I said Mario, I meant Andrew, of course.
You're just in the Italian, New York way. But oh my God, seeing brothers battle on camera, pulling it out to see who's bigger, one more after the other. Now that's why I love New York.
This reminds me of that song, It Takes Two to Make My Hole Feel Tight. In a new hole, stretching it out, honey.
It isn't fair. I thought I wanted Andrew, the big, serious daddy figure. Gosh, he's been great in pandemic, who would protect all of us from Trump. But his playful younger brother is already, now he is so exciting. I feel like I'm in a soap opera and I'm stuck in between two lovers.
Stefan or Damien.
It was nice to see both their humorous side.
Big Finish. Happy 68th birthday to Mr. T.
I pity the fool who doesn't know who Mr. T is, which is kind of me. So I pity myself, I guess. Oh.
I admit I used to watch this when I was little. Age giveaway.
Hearing he was turning, I choked a little on that. Hearing
Surprise.
He was turning 68 today shocked me. I can still recall all of those glistening, bulging muscles from the 1980s. Oh, what was I talking about? I can't remember. I was so distracted. Oh yeah, happy birthday, Mr. T.
Sounds like we needed a video for that production. That's it for today's news for the LGBTQ community on the world's first daily LGBTQ evening news show.
Remember, if it's important to the LGBTQ community, it's important to Q News Tonight. But you must help us. Click subscribe on YouTube and share this news.
We are literally out of the closet and into the headlines. I'm still thinking about Mr. T.
Muscles.
This is the only source of live LGBTQ news in the world. I'm choking.
We're live as we choke.
Joking on the Cuomo brothers.
Exactly. Your community needs your support.
You are not alone. We will get through this crisis.
We are here with you. And this is Q News Tonight.
Thank you for joining us. I'm Al Ferguson, and on behalf of Misty Eyes and Napoleon Plays, we'll see you daily at 7 p.m. Good night. The Happening Out television network is the largest live LGBTQ media platform on the planet. We are excited to lend our support to one of the country's most important health service providers, Care Resource.
With Q News Tonight, It's Happening Out, and Happening.Fun, our network is the most important live LGBTQ video website in the world, breaking the elite 10,000, according to Alexa Analytics, as the number 9,462 highest traffic website in America. And that is out of 900 million websites.
We are proud to share this honor with the company of the historic news magazine, The Advocate, at 11,467. The Lifestyles magazine, Out, at 14,337. America's most important LGBTQ civil rights organization, the HRC, at 22,281. And America's most important LGBTQ media and image organization, GLAAD, at 52,196.
We are prime digital TV partners with both YouTube and Facebook. And in April, more than 2.2 million watched our LGBTQ shows. We are the source for the LGBTQ community for news, talk shows, and entertainment.
In the confidence that you have in Happening Out, we recommend one of America's top health service providers. So many unique services Care Resource provides. The new downtown Miami Service Center is under construction and is scheduled for completion by the end of 2020. We are going to show you a very interesting up-to-the-minute time-lapse of the construction and some of the latest important services by Care Resource while in COVID-19 pandemic. We encourage you to support the Care Resource Center, as your support helps thousands of individuals that help us all to stand up for them. Watch this.
Would you like an HIV test from the comfort of home? Care Resource offers no-cost rapid HIV testing for those who qualify. To learn more about at-home HIV testing, visit careresource.org/home testing. In times of uncertainty, your sexual health is more important than ever. If you recently tested positive for an STI or you're experiencing symptoms, you may qualify for a no-cost doctor's visit at Care Resource. For more information, visit careresource.org. During these uncertain times, we want you to know your local community health center is here to help. Care Resource is offering telehealth visits to new and existing patients from the comfort of your home, office, or mobile device. Call us today or visit us online at careresource.org. What started as several individuals coming together in time of crisis has grown to over 275 dedicated healthcare professionals. What started with one location and purpose has now grown to span 2 Florida counties with 4 locations, providing everyday healthcare. What started with feeding a handful of people over 30 years ago has grown to serve meals and groceries to hundreds of clients each week. Because when we combine local and global talent, we've risen to solve some of the world's biggest challenges. Whether it was working with drug manufacturers pioneering life-saving medications, to today, helping to end a global pandemic right here at home, while at the same time, growing to meet the emerging healthcare needs of a rapidly growing population. And what makes all this possible? Commitment. A dedicated staff committed to providing only the best in healthcare.
Me.
A compassionate team of individuals specialized in their fields.
I.
And competence, providing a one-stop service taking us into the future together.
I'm in it together.
We're in this together. We're in it together.
Compassionate, competent, and committed care. Your community source for healthcare is Care Resource.